Right.
Bring this gray. Deep breath in. Okay. And see if I'm noticing anything. Or pain. No. Okay. All right. So coming in. Can you please verify your date of birth for me before we begin?
January 19th, 1993.
Okay. And your last name?
Santos.
Okay. And you're here for a head-to-toe examination, correct?
Yes.
All right. When was your last annual physical?
3 years ago.
Okay. So it's been a while. Do you have any allergies?
I do. I'm allergic to peanuts
Okay.
and dairy.
Okay. Are you taking any medications on a daily basis?
I do take allergy medicine
Okay.
and Benadryl sometimes at night.
Okay. The allergy medicine, is that on a daily basis or as needed?
As needed in the morning.
Okay. Okay. We're going to go ahead and go over some of the medical history and see if anything applies to you, okay? Any asthma?
No.
Okay. Do you cough at night? Do you wake up coughing?
Sometimes.
Okay. How often would you say it happens in a week?
About 3 times a week.
3 times a week. So 3 times, 1 time per night?
Yes.
Okay. Okay. Any vision problems?
Yes, I wear contacts.
Okay. When was your last checkup?
It was this last month.
Okay. How often do you get a vision check?
Once a year.
Once a year. Okay. Any dental problems?
I do have overcrowded teeth,
Okay.
so the dentist had to pull out 6 of my teeth.
Okay. And how was healing for you? How long did it take for that to heal?
It took a year.
Okay. Are you having any pain right now?
No.
Okay. And do you have any heart problems, any hypertension?
I don't, but it runs in my family.
Okay.
My mom has that.
Okay. Any digestive issues? Heartburn?
I am lactose intolerant,
Okay.
so only when I eat dairy.
When were you diagnosed with that?
When I was 5.
5. Okay. Any hearing problems?
No.
Are you experiencing any back aches?
I am in my upper back, near my shoulders, and on occasion when I bend down or squat or work out in my lower back.
Okay. Okay. Any hospitalizations in the last 10 years?
Yes, there were different occasions where I passed out because I was dizzy and I was taken to the hospital.
Okay. And do you remember what was the diagnosis for that?
It was, I had...
What triggered it?
I had low iron.
Okay. also anemia. And how are you feeling right now? Do you feel dizzy at all?
Sometimes.
Okay. We're gonna do some blood work for that, but we're going to do a physical exam as well to make sure that we're not missing anything serious.
Okay.
Okay. So how many hospitalizations in total?
3.
3. Okay. Any surgeries?
No.
Okay. I'm gonna go ahead and put gloves on and we'll take your vital signs. Okay. Are you experiencing any numbness or tingling sensations in your fingers or toes?
Yes. On occasion, my feet and my hands will fall asleep.
Okay. And for how long has that been going on?
The past 8 months.
Okay.
And I don't know why.
Okay. I'm gonna definitely go ahead and check that as well. I'm going to take your blood pressure, so this is gonna go on your upper arm. Okay, I'm gonna have you relax. Okay, blood pressure is 108/65. That's normal. This will go on your index finger. I'm going to take your heart rate and your oxygenation. And then we'll take your temperature as well. This is going to go on the forehead. Okay. 98.1 Fahrenheit. Heart rate is wonderful, 63 beats per minute, and oxygenation is 97% on room air. Okay. I'm gonna go ahead and start by examining your overall appearance. So as I'm looking at you, I'm not noticing any bruising, any abnormal discolorations. There's no cyanosis around the mouth, so that looks like a very good overall perfusion. I'm gonna go ahead and just place my hands on your skin, especially on your arms, to see if they are equal, okay? Okay, so it's warm. We'll do the same thing on the legs. Very good. Now, if it's okay with you, I'm going to go ahead and take a look at your hair and your scalp. So I'm going to look for anything abnormal, like lumps or bumps, redness. Is there any discomfort that you're having at this moment?
No.
Okay. All right, so I'm just going to lift some parts of the hair. I'm going to try not to be very messy with it. Okay, now I'm going to move behind you and take a look in the back. Okay. I'm going to go ahead and palpate your head. So we're looking for any asymmetry. Experiencing any pain?
A little bit, a little.
Okay, on which side?
My left side.
Did you bump your head recently?
I did.
Okay. So do you think it's in that exact location that's hurting you? Okay, that could definitely explain the tenderness. I do feel a slight bump on this side. Okay. I'm gonna go ahead and palpate your face now. Let me know if you feel any kind of pain as I'm doing that. So we're palpating your masseter muscles and also pressing on the trigger points and checking some of the glands that are in this region. Okay, go ahead and open your mouth slowly and close and open one more time and close. Okay, did you hear any popping sounds?
No.
Okay. I'm going to check your neck as well for any lymph node enlargement. Okay, so we're looking at preauricular lymph nodes, submental, and also we're checking some salivary glands that could show some enlargement in this area right under the jaw. Moving down the back of the neck, feeling for postauricular lymph nodes. And moving down to the axillary lymph nodes. I'm going to lift your sports for a little bit. Okay. Now I'm going to check your thyroid gland. I'm gonna first visualize. I'm not seeing anything swollen. Can you go ahead and swallow for me some saliva? All right. What I'm gonna do now is I will go behind you and I'll palpate your thyroid gland. Okay, go ahead and lift your chin up a little bit. Okay, can you please swallow? Okay, normal movement, trachea is midline. Okay, I'm going to go ahead and check your hearing and your ears now. Are you experiencing any hearing loss, any buzzing, or any other abnormal sounds?
Sometimes there's ringing.
Okay. And is it constant or it comes and goes?
It comes and goes, especially when I listen to music.
Okay. Yeah, sometimes if the volume is a little bit too loud, that could, cause some of that noise for you to hear. Maybe try next time when you hear that to lower the volume by 10, 20, 30% and see if you still hear it, okay? But let's go ahead and check and see what's going on. So I'm going to have you close your eyes. First, I'm going to just palpate and see if I'm feeling anything abnormal. Okay. No lumps there. I'm going to look behind the ear, see if there's anything concerning. Everything is normal. Okay, good. Now, I'm going to make some movements with my fingers, and I'm going to ask you to tell me with which ear you hear this sound. All right? Go ahead and close your eyes.
Left. Right. Both.
Okay, very good. Let's go ahead and check inside. Okay. All right. I'm going to have you turn your head that way. Tympanic membrane is pro-gray. Okay, very good. Everything looks very normal. So what I'm gonna do now is I will check your lungs for that. I'm gonna have to actually visualize the chest area and your back. Is it okay if we put the gown down a little bit?
Okay.
All right. Go ahead and lower your gown. All right. So I'm visually inspecting the chest area. I'm not seeing anything abnormal. Let's go ahead and check the back. Okay, now we're going to check how you take a deep breath in and breathe out. Okay, so lungs are expanding pretty good. We're gonna go ahead and percuss the back and the front area as well. So we're gonna see if there is any abnormality there. Okay, and we'll do the same thing on the front side. Okay, very good. And I'm gonna go ahead and listen to your lungs now. Every time I touch you with the stethoscope, I'm gonna ask you to take a deep breath in through your mouth and out through your mouth again, okay? I'm going to listen to the sides as well. So go ahead and lift your arm a little bit. Good. All right. Same thing on the other side. Very good. Everything sounds normal. And again. Okay, perfect. Okay, now let's go ahead and lay down. I'm going to check your heart. Okay, I'm looking for any pulsations. Can you go ahead and turn your head that way? Perfect. Okay, very good. Everything looks normal. Okay, keep your head that way for me. I'm just going to listen to this side right here. Okay, can you take a deep breath in and hold it for 1, 2, 3. Okay, and exhale. And we'll do the same thing on the other side. Okay. One, 2, and 3. Breathe out. Okay. Perfect. Now I'm gonna go ahead and listen to your heart. Is it okay if you lower the gown again to be able to do that? All right. Okay. So we're looking for any pulsations again. This we would see on the upper chest side, also on the lower chest side. So is it okay if I lower the gown a little bit? All right. So I'm just going to lift this up a little bit and see if I'm noticing anything, which is very normal not to see it. All right, I'm gonna go ahead and now listen to your heart. So I'm gonna put it right here in the middle. You can go ahead and breathe normal as I'm doing that. Okay, and there is one more point here that I would like to listen to. Very good. I'm going to put the sports bra back on. And now I'm going to listen with the bell, so it's the smaller part. I'm going to listen for any murmurs. Very good. Now, is it okay with you if I listen to the abdomen as well, since we are in the same area? So go ahead and put the gown a little bit lower. Great. So what I'm going to do is I will place the stethoscope on the abdomen. It's going to feel a little bit cold. Okay, and now I'm going to go ahead and percuss. And I'm going to palpate your abdomen. Let me know if you feel any kind of pain. So we're looking for anything swollen. Any tenderness. Okay. Okay, perfect. So we're gonna go ahead and put the gown back up. Okay, and I'm going to check your arms now. So first I'm going to take a pulse. Okay, and we're going to compare both sides. Very good, they're both synchronizing. And I'm going to check capillary refill. Very good, within 2 seconds. Go ahead and pull your palms up. We're looking for any pulmonary erythema, any increased sweating. Hands are dry, pinkish in color. Okay, I'm going to palpate your arms all the way up to the shoulder. Let me know if you feel any kind of pain. Okay. And if it's okay with you, I'm going to ask you to turn on your belly and I'm going to take a look at your back and spine.
Okay.
Great. Okay, I'm going to go ahead and expose your back. So we're going to just put the sides right here and we're going to take a look at your spine. Since you also mentioned that you are having some back pain and lower back pain and upper shoulder pain. Okay, I'm going to start by palpating your cervical spine. Thoracic area as well. We're looking for any deviations of the normal curvatures. Okay, I'm not feeling any signs of scoliosis or lordosis. Okay, we're going to take some measurements. Okay, I'm going to tap on your back. Take a deep breath in and exhale. And again. And again. And again. Okay. Very good. So what we're gonna do now is we'll check your legs and your feet. Okay, so over here, I'm going to look for any discolorations, edema. So that's why I'm pressing on the skin, see if there is any indentation. Sometimes a good place to check for that would be around the ankle. Okay. Okay, we're going to check pedal pulses. Okay, 2+, strong and symmetric. Also capillary refill, so I'm pressing down on your nails. Very good. And what I'm gonna do now is I will ask you to try to push with your pads, okay, towards me. Push hard. Good. And we'll do the same thing now. Pull towards you. Okay, so that's pretty strong. Now, can you please push with your heels? Okay, very good. I'm gonna try to open your legs. Don't let me do that, okay? One more time. What about now? I'm gonna try to close them. Don't let me do that, okay? Okay, so a little bit stronger there. Let's go ahead and do that one more time. Gonna try to open them. Don't let me do that. Okay, very good. I'm gonna have you sit back on the table and we'll do more tests. Okay, I'm gonna go ahead and take these off. I'm going to check your reflexes now. For this, I'm going to ask you to relax your jaw. Just going to gently tap. Relax a little bit more. Relax. There you go. Okay. Very good. And now I'm going to move down the body and make sure that everything neurologically is intact. Okay, good. Okay. 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 Go ahead and relax. Okay. Okay, now I'm going to check your knees. So go ahead and relax your legs. Okay. All right, let's go ahead and do that one more time. No. Okay, very good. Let's go ahead and put the gown back down. I'm going to check the inside of your mouth now. Okay, go ahead and give me a big up. All right. And now I'm going to kind of lift your tongue with the spatula to check under. All right, and move your cheeks as well to check around them. Okay, and your lip. Okay, everything looks very normal. All right. You've had a vision check. Let's go ahead and read the Snellen chart. So I'm going to ask you to just hold this chart with your left hand. That's perfect. Go ahead and extend it all the way. Perfect. So that's great length. Are you having any pain? No.
No.
Okay. Go ahead and cover your right eye now. Okay. And can you please read this letter right here?
L.
All right. Go ahead and read the whole row.
L. T. F. P. H.
Okay. And what color is this?
Red.
What about this one?
Green.
Okay. Go ahead and switch eyes. Can you tell me what letter this is?
H.
All right. Go ahead and read the whole row starting with the letter H.
H. P. F. T. L.
Great. And what color do you see here?
Green.
And what about here?
Red.
Okay. All right, we're done there. Go ahead and now look straight in my nose. I'm going to check your pupil dilation. Good. All right. And I'm going to press down on your eyelids. All right. Go ahead and look up. Okay. Very good. Can you go ahead and give me a big smile? Good. And now front with your eyebrows. All right, very good. Can you please puff your cheeks? Keep them puffed for me. Don't let me unpuff them, okay? Okay, very good. Go ahead and breathe in through your nose one at a time. And the other one. Any obstruction there? No. Okay. Any pain?
A little bit.
A little bit of pain. All right, let's go ahead and check inside of your nose. I'm going to have you look up. A little bit of swollen. All right. The message is yes, they're a little bit swollen and red, but that could indicate that you are indeed having some, allergic symptoms, and they do come and go, right?
Yes.
Okay. All right. So we are going to go ahead and schedule you for some blood work. We're going to check you for anemia again to make sure that everything looks good. And if anything comes back abnormal, I'm going to prescribe some iron, okay, that you can take once a day, preferably at night before you go to sleep.
Okay.
All right, we're going to go ahead and do a softener as well. And besides that, everything looks very healthy. I did not see anything abnormal. Do you have any questions for me?
No.
All right. Well, it was a pleasure to meet you. Thank you for allowing me to do this exam on you.
Thank you.
And we'll see you back soon.